beautiful people, and welcome to my channel. Guys, in today's video I want to teach you nasopharyngeal suctioning. Why? Nasopharyngeal suctioning in your Osce exam is one skill that lots of students fail, and in today's video I will enlighten you. And if you have nasopharyngeal suctioning in your Osce exam, trust me, you're definitely smashing it. Before we get directly to the video, I am excited. Guys, do you know all our students passed in first attempt? I'm not joking. So I'll be reading out some of the messages in 30 to 45 seconds. I'm so proud of you, Evans. What Evans has to say. He said, as an overseas nurse adjusting to a new environment in the United Kingdom, it's natural to experience fear and self-doubt about your potential and abilities. When I was looking for an Osce tutor, I sought more than just someone to guide me through intimidating procedures. I was looking for someone with a pure heart, intellectual prowess, and most importantly, someone who believed in me when I doubted myself. During one of those moments searching, I came across a woman who kept saying, Osce is simple and nurses are brilliant. Nurse Violet, I love you dearly. You are a true definition of impact with your selfless teaching. I have achieved this milestone in life by passing my Osce. Today, I celebrate this success because of you. From Evans, your students. Oh my God, Evans, I'm so proud of you. We have Yvonne, another passer in first attempt. She said, Nurse V, I'm in tears now. I can't hold my tears. I know you will be in class now, because she did call me, but obviously I was in class. Nurse V, words cannot express my gratitude. All I can say is God bless you. I passed in first attempt. Thank you so much. You are a born tutor. I'm sending your wine, mama. And this is from Letitia. Nurse V, I have passed my exam in one sitting. Oh, I'm short of words. I don't know what to say. I nearly gave up, but your encouragement and words gave me the hope to keep going. I bless God for making me meet you. Keep going, Nurse V. You are a blessing to many nurses. Thank you, Nurse V. She said your wine is coming. So I replied that, of course, I'm super proud of you. Well-deserved pass. And this is from my darling Ital. She said, mother is love. Love is gold. Thank you so much for holding my hand. I'm so proud of you, Ital. Everybody's testimony I read is all passes in first attempt. And this is from my beautiful Florence. She said, my mentor, my mother. I'm so grateful to you guys. If I keep going on, this video will be more. All our students pass in first attempt. So if you want to join our academic for Osce, and you are more than welcome. All you need to do is send me an email at allboyviolet83@gmail.com and you can enroll. If you don't want the full package, it's an online training session, video classes, video face-to-face classes. If you don't want the full package, you can say, Nurse V, can I opt out for evaluation if that is what you are struggling, and you can get that for evaluation. You can come for implementation if you're struggling with that, and that is it. Literally all our students pass in first attempt. We brag about it and we are happy. So if you are in, email us and you can join our next batch. Now guys, if you have not subscribed yet to my channel, please do. Without wasting any more time, let's get to nasopharyngeal suctioning.
Ryan Little.
Let's get to nasopharyngeal suctioning. The time allocated to the station in your Osce exam is 8 minutes. So immediately your assessor says your next station is nasopharyngeal suctioning, and she says, Violet, your time starts now. First thing first, I check for scene safety. Number 2, I provide privacy for my patients. And number 3, I put an ample amount of gel on my hand and I do my hand hygiene, which is palm to palm, back of hands, interlaced, interlocked, rotation of the thumb, tips to the finger, in the wrist. My hands are what? My hands are clean. Now I pick up my paperwork and I approach my patient. Hello, my name is Violet. I'm one of the nurses looking after you. Can you please tell me your full name, your date of birth, while I double check with your wristband? So the patient says to you, my name is Ellie Brooke. You are looking at your paperwork and your wristband, just as you can see on the screen. My name is Ellie Brooke. My date of birth is 15 February 1940. And then you scream aloud, hospital number 100010. Assessor, I have the right patient. Please, do you have any allergies? Nurse Violet, I don't have any allergies. Oh, beautiful. That's why you have a white wristband on. Seek consent. I am here this morning to sanction you. Is this a convenient time? Yes, Nurse Violet, it is a convenient time. Guys, take note. Immediately you seek consent, because these are the reasons students fail their Osce exam. They forget to tell the patient this thing. So immediately you seek consent. I am here to sanction you. Is this a convenient? And the patient says yes. Number one, you are supposed to be in a semi-upright position with your head supported with pillows. Already, the mannequin is already in that position, but you still have to verbalize it. You are to be in a semi-upright position with your head supported with pillows. Tick! Number two, while I'm sanctioning you, if you want me to stop, please raise your hand. Tick! Number three, Mrs. Haley, can you sniff your right nostril for me, please? It's the assessor that will do it, because you know you are having a mannequin for this procedure. Can you sniff your left nostril for me, please? Assessor, I can confirm that my patient nostrils are patent. I also want to inform you that I will monitor your color, monitor your temperature, your pulse, your respiration, your BP, your secretion, any trauma. I'll monitor your color throughout the procedure. Is that okay? The patient says yes. And now you can leave the patient with the cowbell. Once you leave, so literally I advise you, before leaving the patient to the cowbell, state everything I've stated. Raise your hand if you want me to stop. You are supposed to be seated in a semi-upright position with your head supported with pillow. Sniff your right nostril, sniff your left nostril. Assessor, the nostrils are patent. I'll monitor your color, your temperature, your pulse, your respiration, your BP, literally your vital signs. I'll monitor for any secretion. I'll monitor for any trauma. Okay? And you know, state all these things before leaving the patient to the cowbell. And then you leave the patient to the cowbell. Once you leave the patient to the cowbell, listen attentively here, guys. If you follow my tips, there's no way. Lots of people have used my video and they pass without classes. So do your hand hygiene again. Second hand hygiene now. Palm to palm, back of hands, fingers interlaced, interlocked, rotation of the thumb, tips to the finger, and the wrist. Put on your aprons, put on your glove, wear your face masks, and wear your goggle. Failure to wear your complete PPE is a fail in the Osce exam. For nasopharyngeal sanctioning, you must wear your full PPE. After doing your hand hygiene, listen attentively to me, my beautiful nurses. You must wear your aprons, you must wear your glove, you must wear your goggle or the eyeglass provided for you, you must wear your face masks. Failure to wear this PPE, the way I have said it, is a fail in the Osce exam. So wear your full PPE and assemble all your equipment. The equipment are usually, in most cases, already set up for you. Pick up your catheter. Assessor, I'm allowed to use size 10 or size 12 catheter. The expiry date of this catheter is 15th of July 2028. It is valid. I'm happy to use. This is my suctioning tube. The expiry date of this suctioning tube is July 2028 November. I'm happy to use. This is my gauze. The expiry date of this gauze is 5th of July 2028. I'm happy to use. This is my water, because you'll be provided with water. Assessor, can you confirm this water is within date and use? Assessor will say that is correct. Now, Mrs. Haley, I'm back. Are you happy for us to continue? The patient says yes. Connect your suctioning tube. It's so easy. That's the suctioning tube. Connect it. After connecting your suctioning tube, you now connect your size 10 or your size 12 catheter. Now, connect your size 10 or your size 12 catheter to the suction tube using a NTT. So you see that white connector there, that's where you connect your suctioning tube to. So once you connect one end of the suctioning tube to that white connector, I circled it. Now the other end of your suctioning tube, you connect your catheter using what? A NTT. Your suction machine on. Usually, you should on it to 100 to 150. So you can on it at 100, you can on it at 150, you can on it at 110, usually within 100 to 150. Put it on. And now, take your catheter and put in the water. If the machine is working, the water should bubble. So that's putting the catheter in the water is you have lubricated the tip. And then you tell the patient, I am ready to suction now. Is it your right nostrils or your left nostrils? Probably she says the right nostril. And then you keep going. You keep going. You keep going. Once your accessor coughs, you know that you have met a resistance. Then, once your accessor coughs, I will withdraw 1 centimeter backward before continuing to apply my suction. Now, if your accessor does not cough, as you are passing that catheter, you will definitely meet a resistance. And once you meet that resistance, this is very important. Accessor, I have met a resistance. I will withdraw 1 centimeter backward before continuing to apply my suction. And then you finish. Flush your catheter. Very important, flush your catheter. Mrs. Ailey, do you want me to go a second time? No, Nurse Violet, I am okay. Beautiful. I will take my gauze, clean the patient's face, and make the patient comfortable. Do you have any concern? Like I told you, I will monitor your secretions, trauma, temperature, pulse, respiration, BP, SpO2, and your color throughout this procedure. Okay? Thank you very much. And that's it. Simple. Guys, honestly speaking, Osce is simple, nurses are brilliant. For those of you who will enroll in our class, I'll see you in our video online classes. Until I come your way again, keep passing your Osce exam. I love you all. Bye.